we start, I would like to ask your help to hit the like button, hit the subscribe, and smash the bell. Smash like hawk. Hi everyone, good evening. I'm Dr. Loh, Gynae Penang. Today I'm going to share with everyone about this GE15 Healthcare Manifesto. Alright, because healthcare people, doctors, and people who are interested in healthcare, some of us may be too busy to go through all the lengthy manifesto, so I'm making it simple, summary for everyone to read and compare. Of course, some manifesto is just like guidelines. It may not be set in stones, okay? But it really shows that what goes into the mind of the coalition when they come up with the manifesto and what they have in mind for the rakyat. And of course, those who have a very lengthy and comprehensive manifesto, we also need to think whether they actually goreng it out like what we do in our exam, and whether we must hold them accountable for what they have put in their manifesto. Here we see. All right. So I can't review everyone, so I just review the top 3 contenders, which is the number 1, BN, which the manifesto came up the latest, means the most late ones. All right, the Perikatan Nasional and also Pakatan Harapan. All right, and you can see that they have separate website that you can download their manifesto. And for BN, for healthcare rated, I just able to squeeze in 5 points, mainly 3 points, but 1 point put in other segment. Perikatan Nasional, there's 16 points, 14 points in the healthcare, and one more in other parts. And Pakatan Harapan, there's 12 points in their healthcare part, and there's 1 put separately. I may have missed some, so if you think I've missed any points, you all can just happily list out in this video. All right. So for me to make it simple, I'm dividing the manifesto parts into financing, human resource, primary care, secondary care, and holistic. All right. Of course, my list is maybe there's some area that's overlapping, so please forgive me. But anyway, my list, my rule, right? All right. So first one is about financing. For BN and the Perikatan Nasional and DAP, of course, they have a similar thoughts of manifesto, meaning that they want to increase the annual allocation from currently 2.5 to 5% of GDP, which is 77 billion. All right. The only difference is BN said they will make sure there's quality, there's access, there's expertise, and Perikatan actually promised to increase more than 5%. Okay, and then Pakatan PH promised to increase to 5% in 5 years' time. So probably it's a gradual thing. All right. And for Perikatan, they will have a special fund, okay, for the Penyelenggaraan hospital, okay, maintenance and to fix the broken hospital. All right. And also they have a special insurance schemes for the Rela Anggota, okay, the Anggota Rela. Okay. As for the Pakatan Harapan, they have a health commission which tabulate and monitor the execution of the National Health Reform Plan. So they have a plan, and this one they will go through with various ministry to make sure they solve various systemic issues such as the financing, decentralization of power, the public and private partnership. Looks like a very big plan. All right. And then they want to expand the coverage of My Salam program to the M40, okay? So from the B40 to the M40, all right? And this will cover the critical illness, the admission for hospital, for coverage of health assessment, including mental health care, including counseling. And interestingly, for Pakatan Harapan, they're going to invest more attention, and they have an insurance scheme that cover mental health issue. Okay, it'll be interesting. Not sure how they're going to do that. All right, for human resource, BN just very broadly saying they want to increase the subspecialty training and opportunity in private hospitals to increase number of medical experts. So it's not in a public or university hospital, right? And for the Perikatan, they want to increase Dr. Pakar And they will have a Suruhanjaya Perkhidmatan Kesihatan. It's like a health service commission, which is something similar thought of from the Harapan side, where they have a National Health Service Commission to manage the human resource, staffing, training, and career growth. So career growth includes having more specialists, all right? And on top of that, they also have welfare to look at public hospital staff to operate on shift instead of normal working hours. Well, I don't know what's wrong with normal working hours. Maybe the abnormal working hours is the problem, right? Okay. And of course, the Perikatan have mentioned about want to look more further on the case bully, the kebajikan, and isu kekurangan doktor pakar, right? For the Perikatan, I couldn't find a manifesto in English, so it will be in BM, okay? Words for words from the manifesto itself. As for primary care, the BN, they focus on national subsidy scheme, okay? So it's subsidized, but not free, all right? For mammogram test and cervical cancer screening program, all right? So basically the ladies are gaining a lot from the manifesto if they continue to do this, all right? Okay, for primary care, for Perikatan side, they will have a Pengurusan Kesihatan Negara, but focusing on Wagamas, okay? And they're going to have a system sokongan keluarga pesakit. So it's a support system for the family members of the patient, especially in the Luar Bandar, which is a rural area. And they're going to improve the access of kesihatan mental, which not sure what it means because I think it's pretty accessible for us. And there has a khidmat kesihatan bergerak di kawasan padat penduduk. So it's the bergerak thing, their mobility. And they're going to memperluaskan pendekatan kesihatan preventive. So they have more approaches to preventive medicine, especially or including a non-communicable disease. All right, and lastly, they want to widen the jururawat community JMs, okay, for the patient with disabled patient or their special child in the home. All right. As for Harapan, the same thing. They have the Aging Nation Agenda, and they have another huge plan which they call it Humane Economy Policies and the Siaga Jaga Plan. Okay. Actually, I do not know the full detail of this plan, but basically it's focusing on the aging community. All right. And similarly, they're going to have a service delivery reform where they want to have cover the reduction of waiting period. Okay, they want to modernize the health facility. They want to have a flexible operating hours at clinic, and it's located, of course, located at a high population area. All right. And similarly, they also give special attention to the rise of the non-communicable disease, all right, by focusing more on primary care, health screening, education, public health, welfare, everything, including reduction of harmful habit, all right? And they also want to move towards addressing the social determinants by addressing the poverty, health education, and equal access. And lastly, they want to expand the PERCA B40 to M40 to reinforce the primary care and prevention through system based on capitalizing on the GPs, where there's family doctors who provide regular health assessment, health consultation, and promote healthy lifestyle. Okay. All right, this is the primary care. Very comprehensive from Perikatan and the Pakatan Harapan, but from BN is this one. All right. For secondary care, BN focusing on constructing more specialist hospital for specific medical discipline, such as infection disease or mental health. So maybe you have a Pusat Infectious Disease Negara or Pusat Mental Negara. All right. And they're going to establish the first women public hospital, Kurungan Hawa. I'm not sure that Hawa stands for what. For hospitals specializing in women's health issues. And then for the Perikatan, they also say that they want to menaik taraf hospital daerah. So possible to naik taraf means that to increase more secondary care in the hospital daerah, right? As for holistic, For the BN side, not much of other stuff. For the Perikatan, there's a lot of very how to say, and the good stuff. All right. For instance, they're going to separate out the tax rebate for those stuff that we do, like sports, all right, a gym, all these things that's for health, okay. And then they're going to increase the speed of digitalization and modernization of facility. Maybe I should put this in the secondary care, right? All right, and also they want a how to say a data collection and digitalization of the health. All right, and they also want to build up the pharmaceutical and the healthcare peralatan, okay, healthcare equipments industry, since like they driving the economy. And then they also want every hospital to have their own jaringan pengangkutan awam, okay, their own public transport facility, and network, and also a lot of parking, okay, parkir yang mampan, alright. And they want to try to provide kemudahan penginapan and perikanan hospital, means they want to have more accommodation near the hospital so that the family members of the patient able to stay. And then lastly, they want to have a scheme lawatan doktor to rumah, especially for the warga tua, warga emas, okay, the aging community. Alright. As for Pakatan, they have one is this to solve the period poverty provision by giving a free sanitary pads and tampon for all primary and secondary school, okay, and also free all these things for the women in the B40 at strategic location. And the second thing, they want to decriminalize suicide attempt. All right. So it's very logic that those who face emotional and mental turmoil need to be supported and not to be punished. All right. So I think that's about all the summary of the manifesto. Thank you for listening to me. A very short summary. If you have anything if you have any things that doubt that you think I put it in the wrong classification, well, it's my list, my rules. All right. Thank you for listening. And then if you guys wanted to have a summary PDF, you guys can scan this QR code. All right, QR code here, and then you can get the summary and have a nice day. Make sure you go for voting, and after you vote, make sure you go through the manifesto and make sure the government do what they have promised us. Okay, so what do you support? Is it BN, PN, or Pakatan Harapan? Well, I'm not sure. We support Arsenal!
Okay, we come to the end. If you like this video, hit the like button, hit the subscribe button, and smash the bell, and then share it all away.